I understand inflammation when I cut myself, when I'm swollen with something. I think there's a separate meaning to the word inflammation, and I would love to understand it better. If you could explain to us what exactly do you mean by that inflammation versus what we're familiar with?
Well, just to repeat the question, make sure everybody heard it, I think you're asking, is there a difference between the kind of localized inflammation that you get after an injury where you're healing and the kind of generalized inflammation that we're worried about? And the easiest answer is there really isn't very much of a difference. The only thing is where it's distributed. The issue of inflammation that we're focused on is this global, ongoing, kind of unremitting, never-ending inflammation, which is clearly associated with certain kinds of illnesses, chronic illnesses, and specifically associated, it now turns out, with plain old-fashioned obesity and overweight. And indeed, one can draw a very tight connection between many of the chronic illnesses of obesity and inflammation. That's arthritis and diabetes and possibly hypertension and cancer. And it isn't just breast cancer, it's much more universal than that. So the chronic global inflammatory state, which is like the wound that never stops healing. The inflammation isn't for a week while your elbow heals, it's for years and years, is really the difference. And the trigger to that chronic inflammation is really what we're honing in on.
You know, it's a great question, I think, and we're going to go around the panel about this because we could talk a lot about this, is that for most of human history, people thought that cancer and infections were the same thing. Maimonides had hints that they might not be, and he was considering it, but they didn't have the tools because if you think of an abscess, if you get cut and the bacteria go in there, you get a mass. It's filled with white blood cells, and it's filled with blood vessels. And that's exactly what a cancer looks like. It's a mass filled with white blood cells and filled with blood vessels. The cells that cause the blood vessels to grow come from your bone marrow. They don't come from the local area. The white cells obviously come from your bone marrow. So the similarities between infectious lumps and cancerous lumps is very, very strong. And now we're finding, and people have written about this for centuries without knowing a mechanism, and now we're starting to define a mechanism. And so I was particularly intrigued with what Tom was saying about one of the real advances in infectious disease was the ability to take the bacteria out, grow them in the laboratory, and then be able to figure out how to kill them in the laboratory and then give those same drugs to people so they can kill them in the people. So the idea of a culture method of actually taking cancer and turning it into an infectious disease in terms of approach to therapy is really intriguing. Do you want to have some comments on that? And maybe Edith would jump in on that too. Don? Edith first? Okay.
Yes, I'll be happy to. I mean, it's amazing to think that in 2011 we can do this, that we can actually take a fresh tumor from a patient, take it out, and instead of putting it in paraffin, we can take a piece of it, take it to the laboratory, and start growing it right there. And then take that tumor, identify 25,000 genes, and then connect this with the tumors of another person, another person, another person, to identify the changes in that tumor that are really the drivers of tumor growth and drivers of sensitivity to treatment. So to me, it's revolutionary that we can do this. And to have the techniques and the team working together to make this a possibility. Actually, one of the things that we need, it sounds simple, but we need actually a lot of mathematicians. So Larry, going back to your roots, because we're getting a tremendous amount of information from gene analysis, and we need to put the thousands of pieces of information together so that they make sense in the context of individual patients.